What is the etymology of the disease?
The etiology of cervical cancer is an infection by the human papillomavirus.
How serious is the disease?
Well, in Mexico, it is still the first cause of gynecological cancer. Um it's serious, but it depends on the stage that it is diagnosed in. So if it is diagnosed at an early stage, it could be completely curable. But if it's diagnosed at a later stage, it can be very serious for the patient.
How does it affect the patient lifestyle?
Well, cervical cancer can be a very debilitating disease that can lead even to death depending on the stage that it is diagnosed in.
What are the patient prognosis?
In general, the prognosis, well, it depends on, again, on the stage that it's diagnosed in. In general, it's a good prognosis because it's a very slow evolving disease. So it usually is diagnosed at an early stage, so it usually has a good prognosis. But again, if it's diagnosed at a later stage, it can have a bad prognosis.
What are the patient's main complaints? Major
Uh,
symptoms?
The well, early stages are completely asymptomatic, and later stages, because of the lesions that can be formed, the main symptom can be vaginal bleeding.
How are patients tested for this disease?
Well, each year patients have to be screened by a pap smear. Um, in the pap smear that is made each year, we can know if they have a pre-lesion or if they have a lesion. And they can be tested also for the virus of the BPH.
What are the patient's treatment options?
Well, it completely depends on the stage of the disease. It can be, if there's only an infection by the virus, we can do a local therapy with either cryotherapy or laser. If there's a precancerous lesion, we can do a local surgery. And if there's a more advanced disease, well, the treatment consists of a hysterectomy or even a radical hysterectomy if the stage of the disease is more advanced.
How effective are the different treatment options?
Well, like I said, it depends on the stage of the disease. It's generally very effective, especially for precancerous lesions and cancer stages that are early diagnosed.
What happens if a patient doesn't receive any treatment?
Well, the natural history of the disease is that the lesions will progress, so it's a very slow evolving cancer, but it will eventually evolve for it not to be curable. So it's if they don't get treatment, they can eventually die from the disease.
What new technologies now exist for preventing, diagnosing, or treating this disease?
Well, there isn't anything that's new that works better than the things we have now. So the best thing that women can do is get screened each year with a pap smear, so we can identify the early precancerous lesions. We also have now, because we know that the disease is caused by the BPH, women, children, and also men can get vaccinated for the BPH. We right now have a vaccine that has for 8 serotypes of the virus. So it's the most effective therapy that we have right now to prevent cervical cancer.
Thank you very much.
You're welcome.